PD-1, PD-L1 therapies have recently been shown to be effective in hepatocellular carcinoma. We know that approximately 20% of the patients will respond to anti-PD-1 therapies, but the problem is that we don't really know who these patients are up front. So whenever we are considering immunotherapy in these patients, the scientific challenge behind the question is, who are the patients that we should offer this treatment to? And I think PD-L1 expression has been advocated as a stratifying biomarker, as a predictive correlate of efficacy in these particular tumors. In the early phase trials, it has been shown that PD-L1 is not really predictive of response, and therefore we, in our project, we wanted to establish whether patients with disseminated disease, in which basically HCC has not just spread to the liver but also to other organs, the expression of PD-L1, PD-L2 and other immune-tolerogenic pathways will be differentially distributed across primary and metastatic disease. So we collected a retrospective series of clinical samples that we profiled using immunohistochemistry as well as nanostring technology by looking at immune pathways in the primary metastatic disease. And I think the key finding that we found is that although PD-L2 was universally distributed across primary metastatic disease, PD-L1 wasn't. So there was a great deal of discordance in PD-L1 expression across primary and metastatic HCC. And that to me suggests that we could have had an element of sampling bias, for example, in the prospective clinical trials that have actually assessed PD-L1 as a stratifying biomarker. And what we obtained in terms of novel information from the high throughput technologies such as nanostring that we've used for our study is that it isn't really just about PD-L1 in HCC. So we have got an awful lot of pathways that are actually involved in the immune-tolerogenesis in HCC, in primary and metastatic disease. And in particular, we know that interferon and JAK pathways are involved in shaping the differential regulation of immune control in primary and metastatic disease. So we think that perhaps we should think about intra-tumoral heterogeneity as a big determinant of how and why patients with HCC do or do not respond to these novel therapies. And I think we should take this forward.